Hi, I'm Katrin, physiotherapist, and today I'm going to be showing you a very simple but effective exercise to help to mobilise the lower back. So in this video we're going to be looking at flexion in lying or knees to chest. Like I said, a very simple but effective mobility exercise. So we're going to be laying our backs for this one, so you might want to grab a little pillow or a folded towel just to support the head, and then grab a blanket or a mat to lie on, and make sure you're in some nice comfortable clothing so that you're free to stretch. So let's get started and take a look at this flexion lying or knees to chest exercise to help to mobilise the lumbar spine. Okay, so hopefully you've landed and you're nice and comfy. I've got myself a little folded towel here just to support my head. Feeling nice and cosy. So before we start the exercise, it's nice to just warm up the lower back first, just with simple pelvic tilts. Just gets the back a little bit warmer and more free to move. So tuck the tailbone under and round the back and flatten it in towards the mat. And then arch the back away from the mat, just to get some nice movement around the pelvis and in that lower back area before we do our flexion and lying exercise. So you probably want to do like 10 or 15 of those first, just to get the back ready to move a little bit more deeply. So when we finish those, we're going to start by just bringing one knee up towards the chest and supporting it on the front of the shin just below the knee. Then bring the other knee up to join it. And then just have a little rock from side to side just to get you back nice and balanced and comfortable. Now some people prefer to have the knees a little bit wider, so a bigger gap between the knees. That's absolutely fine, whatever works for you. I prefer to have mine a little bit closer together, but whatever's comfortable for you. And then you're just going to tuck your tailbone under, round your back and hug the knees up and in towards the chest. Now the first 3 or 4 repetitions, your back might feel a little bit stiff and grouchy, but after that it should start to warm up and feel a little bit easier, and then eventually it should feel like a nice stretch, so it should feel like it's doing some good. A lot of patients describe that it feels like their back's opening up, and that's kind of what we're trying to do really, trying to get some nice blood flow into that area of the back, shift any sort of inflammation that's built up there, open out those joints, get them moving again. As I said, you can try it with the knees a little bit wider, just feels a little bit different, but whatever is good for you. There's no right or wrong. Just so long as you're supporting the weight of those legs with your arms. Then when you finish, so 10, 15, even 20 reps, lower one leg down at a time. Our legs weigh quite a bit, so it's good to lower them down by using your hands to help you. Now, if you did find that that exercise was a little uncomfortable, and you'd like to try something a little bit easier, so perhaps you've got a really acute onset of back pain, it's just in that very kind of angry phase, you could just do it with one leg at a time. So keeping the other leg grounded, lift one leg up and just repeat the same exercise with the one leg. And actually this is quite a good thing to do anyway. We tend to get back pain on one side more than on the other. So it's quite good for getting a little bit more stuck into that one side. And because your legs, as I said, weigh quite a bit, it's just less strain on the back when you've only got one leg lifted. So it's a nice way of really deepening into the stretch on one side, but also not putting as much strain on the back because you haven't got the weight of both of your lower limbs to pull on it. So again, sort of like 10 to 15 reps on each side with the single leg. And then if you wanted to develop it further again, you could actually extend the other leg away from you. So tightening the front of the thigh, bringing the toes up towards the nose on that side. Then you could just do that same thing, so you feel like you won't be moving as much this time. And really engage the tummy muscles now as you do that. So as you hug the knee in, tighten through the core, and it can just really help to get to that end of range motion in the back. So quite nice to develop into, but if your back's particularly angry and grouchy, I'd stick to the one with your leg bent up to begin with. Okay, so when you've tried both those versions, you might want to develop onto knee circles. So this is with the 2 legs again. And then trying to make nice big circles, nice and slow and controlled, and using the breath to keep the movement nice and steady. So you take a deep breath in as the knees come towards you, and then a breath out as the knees go away from you. So a breath in as they come towards, and a breath out as they go away. That breath helps to relax the muscles, stops us from holding tension in the muscles. Those deep breaths help to relax the body. So when we're in pain, we often tend to hold our breath. We're kind of expecting pain to happen. So if we get into the habit of doing deep breathing exercises whilst we're moving, it can be a very good way of calming the neuromuscular system down. So calming the nervous system down. And doing those deep breaths. It also stops us from speeding up as well and trying to rush the exercise. Because it feels much nicer if you do it slowly. It's much more relaxing. And then you do it in the opposite direction. And you should feel it a little bit more into the pelvis, these circles, and you get just a little bit of a deeper stretch. It's a really nice one to do. And then when you're finished, the one leg down and the other leg down, and you're done. That's flexion in line. Couldn't be simpler.